Dr. Jamie Metzl. Dr. Metzl served on the National Security Council under President Bill Clinton, the State Department under Secretary Madeleine Albright, and as Deputy Staff Director for Senator Joe Biden on the Senate Foreign Relations Committee. He is currently a Senior Fellow at the Atlantic Council. Mr. Nicholas Wade. Mr. Wade has worked in the field of health and science journalism for more than 40 years. He worked for Nature magazine, Science magazine, and was then the science editor for the New York Times. He is now a freelance journalist and author, writing extensively about COVID-19. Dr. Paul Auwaerter, did I say that correctly, sir? Okay. Dr. Auwaerter was the president of the Infectious Diseases Society of America, the largest professional society worldwide related to infectious diseases. He is currently a professor of medicine at Johns Hopkins University School of Medicine, serving as the clinical director for the Division of Infectious Diseases. Dr. Robert Redfield. Dr. Redfield has spent more than 45 years in medicine and is a virologist by training. He served as chief of the Department of Retroviral Research at the Walter Reed Army Institute of Research, co-founded the Institute of Human Virology at the University of Maryland, and was the director of the U.S. Centers for Disease Control and Prevention from 2018 to 2021, serving during the pandemic itself. Pursuant to Committee on Oversight and Accountability Rule 9G, the witnesses will please stand and raise their right hands. Do you solemnly swear or affirm that the testimony that you are about to give is the truth, the whole truth, and nothing but the truth, so help you God? Thank you. Please be seated. Let the record show that the witnesses all answered in the affirmative. The Select Subcommittee certainly appreciates you all for being here today, and we do look forward to your testimonies. Let me remind the witnesses that we have read your written statements, and they will appear in full in the hearing record. Please limit your oral statements to 5 minutes. As a reminder, please press the button on the microphone in front of you so that it is on and members can hear you. When you begin to speak, the light in front of you will turn green. After 4 minutes, the light will turn yellow. When the red light comes on, your 5 minutes has expired, and we would ask that you please wrap up. I now recognize Dr. Metzl to give an opening statement.
Chairman Wenstrup, Ranking Member Ruiz, and members of the Select Subcommittee on the Coronavirus Pandemic. It is my great honor to join you today. We are primarily here because the Chinese government has done everything in its power to prevent the type of investigation into the origins of the COVID-19 pandemic that is 3 years overdue and still urgently required. We are also here because there is more that we in the United States can and must do to push forward, even if China continues to stonewall. This includes establishing a bipartisan U.S. National COVID-19 Commission. I've waited more than 3 years for these hearings to be held. Getting to this point has required a great deal of effort by a small but tireless, self-motivated, and highly capable community of experts from around the world who have refused to be bullied into silence. Because so many of us have worked so hard for so many years against such ferociously strong headwinds to help lay the groundwork for these hearings, I joined you today with a deep and sincere request that your committee honor our work by making these hearings as evidence-based, probing, and solutions-oriented as possible. Understanding what went wrong and determining how we can do better must be the ultimate bipartisan and nonpartisan issue. I happen to be a Democrat, which is irrelevant to our work together. Since the start of the pandemic, I have been in close contact with officials in the Trump and then the Biden administrations, and have worked with members of Congress of both parties on the pandemic origins issue. Although my views are laid out more fully in my written testimony, I'd like to quickly highlight my key points. First, and most importantly, approximately 20 million people, including over 1 million Americans, have died as a result of COVID-19. These are our parents, partners, children, relatives, colleagues, and friends. We owe every one of these victims and ourselves the fullest possible investigation into how this avoidable tragedy unfolded and our best efforts ensuring that a catastrophe like this never happens again. Second, while the question of pandemic origins remains open, there can be no doubt that a research-related origin remains a very serious possibility, if not a distinct probability. There is no smoking gun proving a laboratory origin hypothesis, but the growing body of circumstantial evidence suggests a gun that is, at very least, warm to the touch. Those feeling otherwise also deserve to have their perspectives and research carefully considered. We should all be open to evolving our views as new evidence emerges. Everyone working in good faith to follow the evidence, wherever it leads, is on the same side. Those working to prevent this type of investigation are not. Third, it is inconceivable that over 3 years after this deadly pandemic began, no comprehensive and unfettered investigation into pandemic origins has been carried out, nor is one currently planned. This injustice is an insult to every victim of this crisis and a clear threat to future generations. The primary reason there has been no comprehensive investigation into COVID-19 origins is the reprehensible actions of the Chinese government. Since the early days of the pandemic, China's government has destroyed samples, hidden records, imprisoned brave Chinese journalists, gagged Chinese scientists, actively spread misinformation, and done pretty much everything possible to prevent the kind of unfettered, evidence-based investigation that is so urgently required. Every person on Earth must demand accountability from China. Calling for a full investigation of pandemic origins in China does not at all mean we shouldn't carefully examine our own behavior and that of our friends and allies. In fact, we must. Fourth, although scientific collaboration, including with Chinese scientists, remains critical to building a safer future, we cannot purchase these relationships by our silence. We must at least match the courage of brave Chinese citizens like Zhang Zhan, who is rotting away in a Chinese prison for asking the same questions many foreigners seem somehow afraid to ask. There is no possible way to establish the principle of transparency and accountability tomorrow without fearlessly and unequivocally establishing that principle today. Fifth, even if China continues to stonewall, there are critical steps we can and must take in the United States and elsewhere to move this process forward. This includes establishing a bipartisan U.S. National COVID-19 Commission to examine the origins issue, as well as other failings and shortcomings on the national and international levels, and develop bold recommendations for next steps. Sixth, because the pandemic has taught us, at least I hope, that in our increasingly interconnected world, we are all only as safe as the most vulnerable among us. Making us more secure here in America requires we do everything possible to help build a safer world, including by helping upgrade the World Health Organization. Although some people have criticized the WHO for how it has dealt with the origins issue, it is my view, as outlined in my written testimony, that WHO Chief Dr. Tedros Adhanom Ghebreyesus has been, in many ways, an unsung hero of this process. Chairman Wenstrup, Ranking Member Ruiz, and members of the subcommittee, our world is entering a new era of globalization, where risks are increasing across the board, including the risk of pandemics far deadlier than COVID-19. If we do not get to the bottom of what went wrong with the COVID-19 pandemic, if we fail in our efforts to fearlessly understand all shortcomings and shore up the vulnerabilities this crisis has so clearly exposed, the victims of the next pandemic, our children and grandchildren, will ask us why we failed to protect them when we knew what was at stake and had the chance. Thank you.
Thank you. I now recognize Mr. Wade to give an opening statement.
Thank you, Mr. Chairman. Although it's a gigantic distraction from the work of your committee, I think I should briefly try to respond to the attempt by Ranking Member Ruiz to discredit my testimony by saying a number of untrue things about the book I wrote 10 years ago on the biology of race. This was a determinedly non-racist book. It has no scientific errors that I'm aware of. It has no racist statements, and it stresses the theme of unity, that we are all variations on the same human genome. My book was vigorously attacked by obscurantist academics who want everyone else to believe that there is no biological basis to race. And my book was as welcome to them as pictures of the Earth from space are to flat earthers. I have nothing to be ashamed of in my book. It's the only place you can now read about what the genome says about human races, and I hope that Mr. Ruiz, if he reads it, will be pleasantly surprised to find that it says none of the things he says it said. With apologies for that digression, Mr. Chairman, I would like to thank you for inviting me to discuss the origin of the COVID virus, and hope you will allow me a few extra minutes. I'm a science writer, and I've worked on two leading research journals, Nature and Science, and then for 30 years on the New York Times, where I was an editorial writer and the science editor. This background has given me some knowledge of how the scientific community works. I'd like to touch on two issues of interest to committee. Where did the SARS-2 virus come from, and why are we taking the lab leak idea seriously only now instead of 3 years ago? When the epidemic first broke out in December 2019, natural origin and lab leak were two equally reasonable explanations. But if the virus had emerged naturally, it should have left many telltale signs in the environment. None has yet appeared, despite the Chinese government's keen interest in finding them. As each month passes without such evidence, the natural origins idea has grown steadily weaker, it seems to me. For lab leak, on the other hand, the evidence has been building. Here are two of the three strongest pieces of evidence in favor of lab leak. First, the epidemic broke out not in some random Chinese city, but right in Wuhan, home of the Wuhan Institute of Virology. We know that scientists there were genetically engineering coronaviruses under seriously inadequate safety conditions. And we know that viruses escape from labs all the time. Clearly, lab leak has to be a strong possibility. Second, that possibility became much more concrete with the recent surfacing of a grant proposal by the Wuhan researchers and others. They applied in 2018 for a $14 million grant from a Pentagon program called Project Defuse. The essential ingredient of SARS-2, as the chairman has said, one which makes the virus so infective, is a small genetic element called a furin cleavage site. Wuhan researchers said in their grant proposal that they would insert this very element into a group of coronaviruses. And not only would they place not only that, they would place the element at a very specific point on the virus's genome called the S1-S2 junction. Now, the DoD turned the proposal down. It was too risky even for them, but the researchers may have done much of the basic work already or could have found other ways to finance it. A year later, the SARS-2 virus appears on the scene, and guess what? It possesses a furin cleavage site, the only known member of its large family of viruses to do so, and the cleavage site is positioned right at the S1-S2 junction. Why should evolution produce at that very time and at that very place a virus of the exact type described in the Defuse proposal? It's surely much easier to believe that the Wuhan researchers did exactly what they proposed and generated the SARS-2 virus in their lab. But if the evidence for lab leak is so strong, why do so many people still believe the virus came from nature? The reason is that the natural origin camp got its story out first, always a big help. It very successfully painted lab leak as a conspiracy theory before anyone had publicly proposed it. The national media swallowed the natural origin story unskeptically, and once committed to it, failed to report important contrary evidence such as the Defuse grant. Science journalists in particular, it seems to me, fell down on their job by failing to check out the virologists' self-serving claims. The natural origin theory did not prevail by accident. It was promoted by science administrators in the United States and England, including Francis Collins and Anthony Fauci of the National Institutes of Health. The NIH is a national treasure, and Collins and Fauci's most prominent leaders at the time are well known to the public and on Capitol Hill. It's hard to believe that in the twilight of their long careers, they would seriously mishandle an issue as important as the origin of the COVID virus. Yet that is what the evidence seems to point to. The campaign to discredit lab leak began on the evening of January 31st, 2020, when Fauci received an email from 4 virologists led by Christian Anderson of Scripps Research. they had all concluded that SARS-2, because of its furin cleavage site, could not have been made in nature. Fauci was probably not too pleased to hear that the virus might have escaped from research that his agency has funded. A strange thing happened to the virologist's conclusion. Within 4 days, Anderson, in an email of February 4, repudiated it, deriding lab leak as a crackpot theory. What made him change his mind? No new scientific evidence about the virus came to light between January 31st and February 4. But from that 180-degree reversal, a whole campaign was able to be developed, including highly influential articles placed in Nature Medicine and the Lancet. I have some ideas about how this and other research should be regulated, which I've described in my written testimony. I'll stop there.
Thank you. I now recognize Dr. Auwaerter to give an opening statement.
Chairman Winstrup, Ranking Member Ruiz, and distinguished members of the subcommittee, thank you for the opportunity to testify. Though I'm from the Johns Hopkins University School of Medicine, I speak on behalf of the Infectious Diseases Society of America, and my statements do not represent Johns Hopkins. Over 1 million Americans have died from COVID, losses that magnify the tremendous suffering among countless families in our country. As a physician caring for patients with COVID for over 3 years, we need to deepen our understanding of the virus's origins and apply experience from the pandemic to improve our preparedness, prevent disease, and save lives. Investigations must be objective and driven by appropriate scientific and intelligence experts who present unbiased findings. Investigations are ongoing. There's no consensus yet about the virus's origins. The Department of Energy, with low confidence, determined the virus escaped from a laboratory in China based on classified information unavailable to the public. The FBI reached its conclusion with moderate confidence. On the other hand, many virologists believe compelling evidence points to an animal origin. They conclude that coronavirus most likely jumped from a caged wild animal into people at a seafood market. We may never know the origin conclusively. Making claims that cannot be supported sufficiently by available data only fuels confusion and mistrust. Regardless, we can learn valuable lessons from these investigations to prevent outbreaks and pandemics of any origin. A robust public health infrastructure and global coordination are essential for surveillance to identify, track, and contain potential threats. Pathogens respect no borders. We must collaborate internationally to foster an unsuspicious atmosphere where global information sharing about infectious diseases is transparent, complete, and rapid. 20 years ago, the SARS outbreak provides an instructive example of what can be achieved through multi-country scientific and public health collaboration. Within 6 months, these collective efforts were successful in staunching the virus, and it has not reappeared. Greater transparency about science, decision-making, and public health will help improve health literacy and rebuild trust in science and public health, including understanding why recommendations evolve as knowledge grows. If people are better prepared to understand science, they will be more comfortable deciding how to protect themselves and their loved ones best. The U.S. should invest in an expert workforce to leverage preparedness tools to benefit all communities, meaning recruiting and training. Significant shortages of public health professionals, laboratory scientists, researchers, and infectious disease physicians persist. Federal investments are urgently needed to fill these gaps. Basic translational and clinical research are crucial for our pandemic preparedness. For example, rapidly deploying tests for a new pathogen will enable quicker scaling of testing capacity when new threats emerge. Investments should also focus on developing therapeutics for anticipated pathogens, including viruses and bacteria, including multi-drug resistant ones. Sufficient infectious diseases research capacity improvements to biosafety are essential. Access to BSL-4 facilities assists in biosecurity research. Therefore, new BSL-4 labs should be strategically placed throughout our nation. The federal government should support biosafety studies, including why laboratory accidents happen, their frequency, and other data needed to create and update evidence-based mitigation measures. Enhanced potential pandemic pathogens, EPP research, a type of gain-of-function research, has received renewed attention. Such efforts can help understand possible human pathogen interactions, assess the likelihood of emerging pandemics, and inform preparedness efforts, including surveillance and medical countermeasure developments. While such research is inherently risky, requiring strict oversight, there are risks if we don't undertake this type of research, leaving us unprepared. Unbiased bodies with appropriate scientific expertise should perform this oversight. Last year, the U.S. government charged the National Science Advisory Board for Biosecurity, NSABB, with reviewing policies regarding EPPP research and dual-use research of concern, DURC. In January, the NSABB released recommendations to strengthen the oversight of EPPP and DURC research in the U.S. and abroad, remove blanket exclusions, expand research types considered EPPP, strengthen guidelines, and increase transparency in the research review process. These guidances can facilitate achievements with improved appropriate guardrails. I am grateful for your attention and for inviting me. The Infectious Diseases of Society also thanks you for your leadership and stands ready to partner with you to learn from the pandemic and to improve our readiness.
Thank you. I now recognize Dr. Redfield to give an opening statement.
Chairman Winthrop, Ranking Member Reese, and members of the committee, I'm pleased to testify today in support of this subcommittee's important work to investigate the origin of COVID-19 that has resulted in the deaths of over 1 million Americans. From 2018 to 2021, I served as the 18th Director of the Centers for Disease Control and Prevention during the Trump administration. As CDC Director, I oversaw the agency's response to the COVID-19 pandemic from the earliest days of its spread, and I also served as a member of the White House Coronavirus Task Force. But perhaps more relevant for the purpose of this hearing, my 45 years in medicine have been focused on the study of viruses. I'm a virologist by training and by practice. Prior to my time at CDC, I spent more than 20 years as a U.S. Army physician and medical researcher at the Walter Reed Army Institute of Research, where I served as the chief of the Department of Retroviral Research, and I worked in virology, immunology, clinical research at the forefront of AIDS epidemic and other viral threats. In 1996, I co-founded the Institute of Human Virology at the University of Maryland in partnership with the state of Maryland, the city of Baltimore, and the University System of Maryland, where I served as the Director of Clinical Research and Care, and I also served as a tenured professor of medicine, microbiology, and immunology, chief of infectious disease, and vice chair of medicine at the university. After my time at CDC, I served as the senior public health advisor to Governor Hogan in the state of Maryland. As COVID-19 began to spread across the world, there were two competing hypotheses about the origin of this virus that needed to be vigorously explored. The first hypothesis is the possibility that COVID-19 infections in humans were the result of a spillover event from nature. This is a situation in which the virus naturally mutates and becomes more transmissible from one species to another, in this case from bats to humans via an intermediate species. This is what happened in previous outbreaks of SARS and MERS and earlier coronaviruses that emerged from bats and spread through an intermediate animal. The second hypothesis is the possibility that the virus evolved in a laboratory involved in gain-of-function research. This is a type of research in which scientists seek to increase the transmissibility or pathogenicity of an organism in order to better understand that organism and inform preparedness efforts and the development of countermeasures such as therapeutics and vaccines. Under this theory, COVID infected the general population after it was accidentally leaked from a lab in China. From the earliest days of the pandemic, my view was both theories about the origin needed to be aggressively and thoroughly examined. Based on my initial analysis of the data, I came to believe, and I still believe today, that it indicates that COVID-19 more likely was the result of an accidental lab leak than a result of a natural spillover event. This conclusion is based primarily on the biology of the virus itself, including the rapid high infectivity for human-to-human transmission, which would then predict rapid evolution of new variants, as well as a number of other important factors, which also include the unusual actions in and around Wuhan in the fall of 2019, all of which I'm happy to discuss today. Even given the information that surfaced in the 3 years since the COVID-19 pandemic began, some have contended that there's really no point in investigating the origin of this virus. I strongly disagree. There is a global need to know what we are dealing with in COVID virus because it affects how we approach the problem to try to prevent the next pandemic. The understanding of the origin of COVID is critical to future science research, particularly as it affects ongoing ethical debate around gain-of-function research. Gain-of-function research has long been controversial within the scientific community. In my own opinion, COVID-19 pandemic presents a case study on the potential dangers of such research. While many believe that gain-of-function research is critical to get ahead of viruses by developing vaccines, in this case, I believe it was the exact opposite, unleashing a new virus to the world without any means of stopping it and resulting in the deaths of millions of people. Because of this, it's my opinion that we should call for a moratorium on gain-of-function research until we have a broader debate and we come to a consensus at a community about the value of gain-of-function research. This debate should not be limited to the scientific community. If the decision is to continue with gain-of-function research, then it must be determined how and where to conduct that research in a safe, responsible, and effective way. I thank you for inviting me here today. As we explore this important topic, I look forward to answering your questions. Thank you.